Hi everyone, Al the Psych again, and what I'm doing is my part two of hoarding. I talked about hoarding in the other video, really with regard to describing it, talking about it. Uh, this section is going to focus more on treatment, and as usual, this is for informational purposes only. Go ahead and do your own due diligence. Okay. Let's get to it. So, as I've been reading about hoarding, hoarding can be difficult to treat, and more so if the individual's insight is limited or poor. Okay, so if the person thinks, I don't have an issue here, even though the family members are complaining constantly, well, then again, treatment's going to be that much more difficult. CBT, cognitive behavior therapy, is kind of like the treatment of choice. Um, Apparently, the success rates are not that good yet. Okay, so the therapist or psychologist working with the individual with the hoarding disorder will sometimes use what's called a downward arrow technique or Socratic questioning to really try to find out why the item is uh, so important uh, to the individual. And it's kind of like, peeling an onion. You're getting rid of layer after layer to see if you can kind of get to the crux of the matter. Um, Now it's interesting. As I was doing a little research on the subject, I came up with some interesting things about what some therapists do in terms of treating individuals with a hoarding uh, disorder. And sometimes what might help is for hoarders to take pictures of the items before they discard them. So if you're an individual with a hoarding disorder and maybe there's a memory component, like if I'll forget about this item completely, I can't do that. I don't want to do that. But if you've got um, the picture of that particular item, that at least will then be able to help you, assist you in conjuring up, you know, the memory. Oh yeah, that's that item. Yeah, I remember that. And this item is associated with this particular event and this particular feeling and these particular uh, people. Okay, so there, for some individuals, taking pictures of the items before they're discarded uh, can help relieve the anxiety, and therefore help them with letting go of their some of their items. Um, Now, for some hoarders, stopping the avoidance can have a dramatic effect. Um, so, many individuals with a hoarding disorder will show a pattern of habituation after giving up an item. So the distress will dissipate at some point. So the hoarder learns he can get rid of the items. This is huge. If you can do that, you start with one item, and if you can uh, get the individual to get rid of it in time, that individual learns that, oh yeah, okay, yeah, it was really upsetting when I did that. On a scale of 1 to 10, it was a 10. But 2 days later, it was on that scale of 1 to 10, maybe it was a 5. So if they start understanding this, if those individuals start understanding that, yes, I got rid of it, it was hard at first, much easier after a couple of days, 3 days, whatever, makes it a little bit easier to then let go of other items. Um, they they learn that they can tolerate the anxiety and the grieving. Um, So, and like I said, the therapist sometimes will use a rating scale, whatever scale you want to use. You have a scale from, 1 to 10, 0 to 100, whatever, and you're looking at subjective units of distress, and then you're rating it at the time, and then maybe, a couple of days later or a week later, you can get an idea of how that distress is, hopefully, uh, dissipating. Um, so usually or often the level is initially very high in terms of distress, but subsides after a few days. So this is very uh, important. Okay, that's excellent news if you're an individual with a hoarding disorder and are hoping to get rid of some of that stuff that you've accumulated. Now, some hoarders have what was coined as clutter blindness. So they don't really. You get so used to just kind of seeing things in the way that you have them laid out in your home. But sometimes if you take pictures or videos and then you show it to the person with the hoarding disorder, it gives them a different perspective, like a different angle on what their environment is really like. So if there was some lack of insight on there being a problem, and then you present this video, you as a therapist or somebody who's trying to help them get rid of items, you present this video, it's like, oh my God, I never really kind of saw it like that. So sometimes that can trigger a little insight and recognition that, oh yeah, there's something that needs to be done. I need to start filtering through some of this stuff. Now, you've probably seen all the TV shows, the forced clean outs, things like that, and they can be long and they can be acrimonious, and often in the end they're ineffective. They don't actually address the behavior problem. What happens is, you get rid of the stuff, and then you go back a year later and other stuff has been purchased and gathered and has replaced the stuff that was outgoing. There's been more stuff, incoming. So, as I check my notes here, okay, a hoarder's attachments to his things and decisions about acquiring and saving will not change if he doesn't participate in the process, in the disposal of the stuff. So, if you're working with someone with a hoarding disorder, make sure that that person, he or she, is participating, as opposed to you just kind of going in, swooping in, and chucking stuff. Now, reading some research. So some research has indicated, and this is a big if, but if you can get hoarders to let go of sentimental items, the ones that they really have some sort of sentimental attachment to, if you can get them to let go of some of those sentimental items, the other items, the ones without the sentimental value, will be easier to get rid of. And it'll really facilitate the process of decluttering. So it's a big if, but if you can do that, the ones that they really have that attachment to with regard to sentimentality, get rid of that. The other items that are more related to, a memory issue, if I might forget that if I don't see it, those items will flow a little bit easier out the door. Okay. So one more thing here. Sometimes the therapist will work with the individuals on going, like, on non-acquiring shopping trips or trips to look at things but not actually acquire them, because the therapist will be there, and the individual might say, oh, I'm going to get this, or I'm going to get that, and the therapist is there to say, well, do you already have one of these? Do you really need this? Do you see this as something that you would actually use down the road? Is this something that you kind of see as connected to your identity? So the therapist sometimes will do that, do an in vivo sort of shopping trip with an individual, just working with them on not acquiring stuff. And then sometimes obviously the therapist is not going to be able to do that all the time. So when the therapist can't accompany the individual everywhere he or she goes, they'll ask that the client create a list of acquisition questions to carry with them. So it's kind of like being proactive. Instead of getting rid of stuff, it's like, let's be proactive and let's not get the stuff in the first place. Okay, so questions again would be what I just mentioned. Do I, on the list, do I already have something like that? Well, yeah, I've got 5 of these. Okay, so I really don't need a 6th one. Okay, do I have a place to keep it? Well, things are pretty cluttered, so I really don't have a place to keep it. I want it now, but will I really think I want it, down the road? Okay, will my feelings or thoughts about wanting it change tomorrow or the next day or next week? Okay, so you kind of see how that works. So those are some of the strategies and treatment methods that are used, and that's pretty much it for now. I'm hoping that is useful because it's kind of a difficult topic to talk about in terms of treatment that has been it's been a little marginal. And one thing I should probably end with is something that I think needs to be done continually. It's not like, okay, yeah, I've gotten things cleared out and now everything's fine. No, I think it's this is something that should be ongoing. That little card with the questions is something that will be useful to, if you have a hoarding disorder, to carry all the time, because it's so easy to relapse and just fall back into your default mode and the old pattern of doing things. So you want to make sure that this is using that card, questioning whether you should get the items, things like that. That should be done on an ongoing basis, forever, basically. So, hope that was useful. If you have questions, comments, go ahead and leave them, in the comment section. And that's it for now. Thank you.